In this video, we present a combined surgery of cataract phacoemulsification with toric IOL implantation and non-penetrating deep sclerectomy. This surgical procedure was performed in order to treat a 62-year-old monoocular patient with progressing glaucoma. Intraocular pressure was 28 mm of mercury despite maximal medical therapy and selective laser trabeculoplasty. The patient had a cup disc ratio of 0.8 and a generalized decrease of the parapapillary retinal nerve fiber layer thickness. The eye also had high astigmatism of 4 diopters. In order to choose the right IOL, Barrett toric calculator was used. It was, therefore, decided to proceed with a combined approach of phaco-deep sclerectomy. The alignment of the IOL was performed with the assistance of Verion image-guided system. The incisions were made at strategic sites in order to facilitate the rotation of the IOL. Capsular hexis, hydrodissection, nucleus fragmentation and aspiration were performed without incidents. The IOL was then introduced and rotated to the correct axis with the aid of Verion. The filtration surgery was then initiated. The conjunctiva was opened in the limbus, and cauterization of the episcleral vessels was made. Mitomycin C was applied for 2 minutes. The dissection of the superficial and deep scleral flap were uneventful. After verification of good aqueous humor percolation through the trabeculodecumetic window, a deep sclerectomy was completed with the implantation of an ESNOPER V2000 scleral implant. Conjunctiva closure was carried out using reabsorbable sutures. Finally, methylprednisolone was injected in the subconjunctiva. 8 months after the surgery, the patient remained subjectively very satisfied and intraocular pressure is controlled. A diffuse and posterior functioning bleed was obtained. On examination, she presented an uncorrected visual acuity of 20/20 with a residual refractive cylinder of 0.5 diopters. Intraocular pressure dropped more than 50% to 12 mm of mercury without any medical treatment. In conclusion, great results, both refractive and intraocular pressure control, can be achieved in only one time, combining phacoemulsification with toric IOL implantation and filtering surgery.